I'm José Tomás Arenas, and I'm a co-founder at dartbyteledx.org, Artificial Intelligence for Blindness Prevention. We're facing a global epidemic. Diabetes affects more than 415 million people in every region of the world. That's 1 in 11, that if they don't check in their eyes each year, will simply become blind. If we put into the equation the lack of eye specialists, the result is that diabetes-led blindness is simply the fastest growing cause of blindness worldwide. That's why we created DART, an artificial intelligence-based software to automatically detect and prevent diabetes-led blindness. How does it work? Patients come to the point of care where a technician uses a camera to take the eye exams digitally and then enter them to our cloud service. That's where we come in play. The images are uploaded to our web-based platform where retina disease signs are automatically detected, so more than 2/3 of the cases can be automatically discarded without the intervention of an eye specialist. For the third that is left, the platform has an interface for a specialist to give the recommendation and referral and then close the gap of the attention and prevention in this disease. Our most important value proposal is for healthcare systems, both public and private, for example, private insurance, as they are the payers and they can raise their coverage up to 5 times, focusing on prevention and putting their resources in that phase and not in late treatment, which is costly and non-efficient. We have been doing this possible with a multidisciplinary team, mainly from eye specialists and engineers, experts in AI, and that's why we have received a lot of validation and support, including becoming recently the standard for the Chilean government, for the teleophthalmology program, and every case of diabetic patient which is checked in the eye passes through our technology. And now we're looking to expand, to scale through Latin America and through the world, and that's why we're looking for partners for deploying in a more rapid way. Thank you.
Okay, really good. Okay. Okay, first question here.
Yes, congratulations. My question is about your intellectual property. What is the status of your intellectual property? And also, I imagine you need some kind of certifications to enter into the markets. So can you talk about that, please?
Yes, we're working first in IP. We decided a while ago to use a first-in-the-market strategy, at least in Latin America. And we are also working right now in a US patent. And in terms of certification, we have several articles published in conferences, and one to be published, and going through quality standard, which is the first step to CE mark for Europe and FDA.
Thank you.
Okay, ooh, loads of questions over here. Okay, all the way from San Francisco.
Yeah, how do you acquire customers, and what's the cost?
It depends on the health system. In Latin America, the customers are mainly public health. That's why our network we've been building for champions, which are ophthalmologists in public health, are our channel. Also, in a minor way, private insurance, and in different systems like the US are totally private. That's why the strategy is different.
My question is...
Sorry, just to clear, that's why we're also looking for partners and champions in local regions to speed this up.
Yes, it's in this way. The public health insurance or the sector in Latin America is very different in all countries. What about that?
Yes, it is different, but in some countries there are much things in common. That's why we are working in small pilots, for example, in Peru and Brazil, and starting in Mexico. And these are small pilots in local hospitals or centers that then present this strategy to scale through the national healthcare system. So that's the strategy we've been following until now.
Okay, that's it. We're out of time. Well done. Congratulations and best of luck with everything. Okay, round of applause for Tomás.